We look at a lifetime incidence of around 20% for major depression, and in any one year about 5 to 7% of the population will have an episode. We know the rates are higher generally in women, about 2 to 1, and do increase with age, although there's also a spike in adolescence and early adulthood. So we're talking about a pretty serious health condition that's amongst the leading causes of disability in Australia and globally. We still haven't developed a perfect screening tool for depression, and the clinical interview remains the gold standard. So asking patients about symptoms of depression and really maintaining a high threshold of awareness of the possibility, particularly in those patients with chronic physical health problems, we know the rates are really high. I think the biggest change in the treatment of depression is the recognition of how frequently it's a recurrent condition. So by the time someone's had 3 episodes of depression, the chance of having another one the next 3 years is 80%. So we really need to get on with treating it well. We have a range of antidepressants available to us. The most recent entrants onto the market are argamelitine and vortioxetine, and they're all effective compounds. There's no way of predicting with certainty what's the best for the individual patient in front of you, but we do know that with persistence, the majority of patients can get into remission. Maintenance therapy is a really important consideration, and patients need a lot of information, otherwise we know they won't adhere. So in addition to the medication, structured psychological therapies like cognitive behavioural therapy and interpersonal therapy, IPT, have level 1 evidence in the treatment of major depression. And we know they can also be effective in preventing relapse. So they're probably the treatments of choice for mild major depression. They can also be useful augments to medication in moderate, but in severe major depression we really think the biological therapies are more central. Oh look, I've enjoyed my involvement in the GPCE greatly, and it's terrific to see this number of GPs gathered together with the opportunity to engage in a host of topics. I'm very pleased that a number engage in the topic of major depression, which I obviously think is very important. So I congratulate Reid on organising an event like this that offers this opportunity to GPs.